Hello, welcome to part one of the patient-centered care lecture about supporting adherence. I think most of you have met me now, but just a quick reminder that I'm Kate Fletcher and I'm an Associate Professor of Pharmacy Education and Practice. So looking at the learning outcomes for this lecture, initially we're going to look at the concept of medication non-adherence and understand what it means and some of the causes. And then in part two, we'll look at some more reasons for non-adherence and how, as pharmacists, we can support patients to take their medication regimen in a better way. In this lecture, we will look at some definitions relating to medicines adherence, reasons that patients may be non-adherent, and how, as pharmacists, we can better support patients to be adherent to their treatment. So you may wonder why this subject is important, but it's estimated that 30 to 50% of medicines prescribed for long-term conditions are not taken as directed by patients. And obviously this means that patients are not going to get the maximum benefit from their treatment, and that could have negative effects on their health in the future. As a pharmacist, you should be able to identify some of the behaviours that lead to non-adherence and recommend suitable approaches to intervene and help patients improve their adherence. You should be able to instruct patients in the safe and effective use of all of their medicines and devices. And using your communication skills, you need to be able to communicate all of this information to patients about their prescribed treatment. So you might be surprised to find or to learn that about 50% of patients do not take their medicines as intended, which is pretty shocking. That's a survey performed by NHS England just last year. So 50% don't take their medicines as intended. And about 1 in 10, or probably more than 1 in 10, medicine-related harm incidents in older people following discharge from medical care are due to non-adherence. So medicines-related incidents in older people due to patients not taking their medicines as intended. And that data was published in the British Journal of Clinical Pharmacology in 2018. So let's look at some definitions of words related to patients and how they take their medicines. Compliance is a term that's not used so much anymore because it has some negative connotations, but is defined as a patient's degree of conformity with the advice and recommendations given by HCPs or healthcare professionals. Non-compliant was a term used to describe a significant failure to conform with advice and recommendations to the extent that it interferes with achieving the outcomes planned for a patient, such as not completing an antibiotic course, for instance. But it tends to be, non-compliance tends to be thought of as negative because it overrides the concept that the patient may have a problem with the medication or recommendation, which has led to them not taking their medicine properly, rather than just ignoring the advice. So compliance can relate to any healthcare advice or recommendations, so not only medicines, but also perhaps following a particular special diet or making lifestyle changes. Another negative side of this word is that it also denotes a passive role for the patient where they just have to do as they're told, rather than having any choice in the situation. So really we've moved on from using the word compliance, although you may still hear people use it. So the word we're using mostly in this lecture is adherence, and this is the extent to which patients' behaviours match the agreed recommendations from the prescriber. This does have a more positive connotation, and the patient does have a more active role and they have freedom of choice. Healthcare professionals have a responsibility to facilitate adherence, and patients have that choice as to whether they follow recommendations or not. Healthcare professionals should be encouraging patients to agree to a recommended regimen. And although we've really also moved on from using adherence, we are using that word still in this lecture. Concordance is the most recent and all-encompassing word, I guess. It's the degree to which the patient and the healthcare practitioner agree about the nature of the illness and the need for management, and the relative risks and benefits of the proposed line of treatment. It can also be defined as an agreement reached after negotiation between a patient and clinician, and it respects the beliefs and wishes of the patient in determining whether, when and how medicines are to be taken. So you'll notice that that matches quite a lot of what other things that we've discussed this term about involving patients in their treatment. So patients are involved in decision making about their treatment. They have an active role, and it should be the treatment should be an agreement made between patient and healthcare professional. So although in this lecture we talk about adherence, which is a more acceptable word than compliance, also remember that others may use the word concordance. To help us understand about adherence and concordance in treatment, we're going to use a scenario to illustrate the issues that we're thinking about here. So our scenario for this lecture is that Mr. Walia brings in his prescription for you to dispense. He's a regular at your pharmacy and states he's just been advised by the doctor that this medicine should be taken in the morning around breakfast time. He does not have any allergies that he is aware of. And the prescription is for levothyroxine, 100 micrograms once a day. So first things first, as a pharmacist, you need to know everything necessary about each drug that you come across and each drug that you dispense. And so just to make sure that you know the information needed, you look up in the BNF, and this will help you understand whether this prescription is correct and also the information you need to be able to give the best advice. So in the BNF, the dosing instructions for an adult aged between 18 and 49 years. So note that with this medication, adults, there is a specific range for adults. In a lot of medication, adult is assumed to be over 12 years, sometimes over 18, and generally right through until death. But with this drug, there's a specific adult dosing range, so you need to take note of that and just check that against the age of your patient on the prescription. So for an adult of 18 to 49 years, the initial dose would normally be 50 to 100 micrograms once daily, and that's adjusted in steps up of 25 to 50 micrograms every 3 to 4 weeks, adjusted according to response. So the response there would be according to blood tests to see whether this medication is at the right level. And a normal maintenance dose for an adult of this age is somewhere between 100 and 200 micrograms once a day. The dosing information also states, as you can see, dose to be taken preferably at least 30 minutes before breakfast, before caffeine containing liquids such as coffee and tea, or before other medication or other medication. So you probably won't know what levothyroxine is yet, so we'll just have a quick run through. It's a synthetic thyroid hormone and it's used to treat hypothyroidism. There are multiple causes for hypothyroidism, but they all result in the underproduction of thyroxine by the thyroid gland. And levothyroxine is given as the sodium salt in a single daily dose. Its absorption can be irregular, so it's probably best taken on an empty stomach, usually before breakfast, hence the instructions on the previous slide. And it's important to remember that the peak therapeutic effect of regular oral levothyroxine may not be achieved for several weeks. So it's important for the patient to understand that, and also that will explain why dose adjustments should be made at 3 to 4 weekly intervals and no sooner than that. So looking at hypothyroidism, there's a range of symptoms, signs and symptoms of hypothyroidism, in particular things like tiredness, depression, slow movements and thoughts, dry and scaly skin, loss of libido and constipation. So these are all signs that metabolism is decreasing, really, and of course the other effects of low thyroid hormone levels. So thinking about when you're talking to the patient about this medication, having considered the information that we've just looked at and the dosing information, the pharmacist would want to tell the patient to take 1 tablet in the morning. That's the basic information to ensure the patient takes it at the right frequency. The patient should take the tablet before food or before caffeine, and take the tablets at the same time each morning, and that the tablets may take a few weeks to start working. So that's the key information really about how to take this medicine properly. But what might the patient be thinking? So as the pharmacist, the patient might be smiling and listening to you and nodding and agreeing, but that might not reflect what they're truly thinking. So this patient could be thinking, wow, it's a really tiny little tablet. How's that going to change anything? What's she looking so happy about? I'm really ill and she's just smiling at me. What if I get worse? The doctor said I had to go back for more tests. What's that all about? I thought they'd decided what was wrong with me. And some patients might not trust you, depending on them and depending on you. So some patients might be thinking, oh, I don't think she knows what she's talking about. You can keep talking, but I'm not going to take these tablets. So, and this is not really an uncommon reaction when people start taking medication. Sometimes, unfortunately, the side effects of the medication, although can be an indication that the patient is taking the medicine and so hopefully it's going to work, can also be worse than the actual condition that they're treating. So, side effect information for levothyroxine in the BNF, and the frequency of these side effects is not known. And when you get used to using the BNF, you'll see that often the frequency is indicated, but there's quite a range of side effects for levothyroxine here. We've got anxiety, diarrhea, malaise, muscle spasms, edema, palpitations, decrease in weight. So some of these side effects are quite unpleasant. And you can see why, if somebody was experiencing some of these and if they were quite bad, they might not be very happy with this treatment. So another little cartoon here. Some patients will stop taking their medicine because the side effects are so bad that they'd rather just go back to feeling unwell with the original disease. So thinking more specifically about poor adherence, what is poor adherence? So it could be that somebody is just missing the odd dose here and there. Maybe they're just forgetting to take their dose sometimes, or sometimes they miss several days in a row. Perhaps they've altered the dose taken, so they might increase it or decrease it depending on how they're feeling. Replacing or supplementing medicines with non-pharmacological treatment. That's not all. Replacing obviously would be undesirable. Supplementing may not always be bad, but if you're taking something herbal, for instance, then there could be an interaction. Some patients might think, well, I feel better now, I'm going to stop this medicine and I'll see what happens. And obviously for chronic conditions, that's not a great idea. Some patients may think, well, I've got 10 different tablets I have to take. I'm fed up with this. I'm not going to take all of them every day, that kind of thing. particularly in countries where patients have to pay a lot for their medication. They may be obtaining information from non-medical sources, which contradicts the information they've been given by healthcare professionals. They may know somebody who takes the same medication and be thinking, gosh, well, look what it did to my mates. I don't want to take this myself. So you may be thinking, well, why does low adherence really matter? Well, of course, if somebody's not taking their medicine properly, then they're not going to be getting the full clinical benefit of their treatment. And so then their disease is going to continue and may even get worse. And in 2008, the authors of a Cochrane review stated, increasing the effectiveness of adherence interventions may have a far greater impact on the health of the population than any improvement in specific medical treatments. So basically they're saying we've got medical treatments, we know they work because they're tested and peer reviewed, and we just need patients to take them properly, and then we'd get much better outcomes because so many people don't take their medication properly. So this is a good time to take a break in this lecture. We've looked at what non-adherence is and some of the reasons for it. And in the next part of the lecture, we'll look at more reasons for non-adherence and how, as pharmacists, we can support patients. So take a break if you wish, or you can carry straight on to part 2. It's up to you.